Nurses are the largest group of professionals in the healthcare system, and they are vital to its success. Experiences of working under sustained, intense pressure during COVID-19 heightened awareness of the problem of moral distress. Moral distress is the negative thoughts and feelings experienced when nurses find themselves in situations where they or others are not acting in a way that is consistent with their values and standards. Dr. Georgina Morley identified 5 subtypes of moral distress. International evidence shows that moral distress can negatively impact health workers both professionally and personally. A systematic review of 77 international research studies identified the sources and effects of moral distress among nurses and nursing students. The review found that moral distress was connected to nurses' perceived inability to act ethically while trying to safeguard core professional values. The review also identified numerous sources of moral distress among nurses that were consistent across continents, care settings, and nursing specialties. These were the organisational environment nurses work in, relationships and dynamics within and between teams, and personal characteristics of individual nurses. The review also identified that moral distress has a negative effect on nurses' physical health and psychological well-being. A range of physical problems can be experienced, including fatigue, hypertension, and anorexia. Psychological effects include anger, anxiety, and shame. And social isolation and disrupted relationships were also identified. Moral distress can also impact individuals' intentions to continue to work as nurses. Nurses and nursing students in Wales were surveyed about moral distress during the COVID-19 pandemic. It was found that moral distress was significantly linked to depression. High moral distress scores were reported by nurses who had been redeployed to different working environments during the pandemic, by less experienced registered nurses who cared for more than 40 patients with suspected or confirmed COVID-19, and nurses who intended to leave nursing altogether. Nurses also reported unhealthy coping strategies and feelings of isolation. Many doubted the longevity of their nursing careers due to feeling undervalued and the health impacts of working during the pandemic. Findings from this research showed that it's time to take moral distress more seriously. It can be hard for nurses to speak out, so we need organisational policies that enable them to safely raise ethical concerns. Healthcare organisations have a duty of care to their nursing staff, and they must work with nurses to prevent and mitigate moral distress. This will help support recovery, rebuilding, and most importantly, retention of the nursing workforce.